I'm Dr. Gouda Mustafa, orthopedic consultant in Medexpress Hospital. Today, I will talk about the differences between sprain and fracture. First, need to know what is the joint. Joint means two bones or more attached together and space in between, this space called joint. This joint covered by the capsule and ligaments around. These ligaments give strength and stability for the joint. If any trauma to this joint may affect the bone or the ligament. I will explain how to know if this trauma affecting my bone lead to fracture or only affecting the ligament lead to sprain. To know the difference between the sprain of the ligaments and the fracture of the bone, first, what are the symptoms? If I got trauma now to my ankle, I have pain, swelling, some restriction of movement, painful movement. I will tell you how can you know, is it simple sprain of the ligaments or maybe fracture. For sprain, if you get trauma to your joint, there are three types of sprain, not only one. First type of ligament sprain, after twisting your ankle, your joint, you feel mild pain, maybe mild swelling, and you can move your joint. It is type 1 ligament sprain. Second one, mild to moderate pain, mild to moderate swelling, and you can move your joint but with pain. Third type, you will feel moderate to severe swelling, moderate to severe pain, and normally it will be restriction of the movement. You cannot move your joint. First one is ligament sprain, simple. Second type is partial tear of the ligament. Third type is complete tear of the ligaments.
This is for the ligaments. For the bone, any trauma to the bone lead to fracture. Also, the fractures not one type, maybe simple crack to your bone lead to hairline fracture. It will be equal to the ligament sprain. You feel some pain, swelling, and you can move your joint and your limb. Is the second type, fracture of the bone, complete break of the bone. You feel pain, swelling, and you can move your joint but hardly. Third one, complete fracture of the bone with displacement. You will see some deformity. Your joint is not normal. Also, for the fractures, maybe near to the joints or away from the joint. If I have fracture here, it is fracture. It is not ligament sprain. Sprain mainly in the joint line.
Now, I have trauma to my ankle, my wrist, any joint, maybe ligament sprain, maybe fracture. What should I do? We have RICE technique. RICE, R-I-C-E. R for rest, better to avoid any painful activities or movements for your joint. I for ice, better to apply ice packs for 20 minutes every few hours. C for compression, better to apply grip bandage or any support to your joint. E for elevation, better to elevate your affected joint. Elevate your leg, elevate your hand, your arm to avoid swelling. What about the final treatment? First, for the mild sprain, it is not urgent to go to the hospital and to see your doctor. Just take rest, foot elevation, ice. For 2-3 days, you will be good. For grade 2 and 3 ligament sprain, better to go to hospital and see your doctor. Maybe fracture. The final treatment of the fracture will be decided by your doctor according to the fracture type, your age, and the general condition. Here, In Medexpress, we have the latest technology to investigate, diagnose, and treat all the ligament sprain and all the fractures. Medexpress Hospital, a passion to care, the power to cure.